What risks are associated with electromyography, EMG, in muscular dystrophy? When considering electromyography, or EMG, for patients with muscular dystrophy, it is essential to understand the associated risks. EMG is a diagnostic test that evaluates the electrical activity of muscles and the nerves controlling them. This can be particularly helpful in diagnosing muscular dystrophy, which is a group of genetic disorders that lead to progressive muscle weakness and degeneration. The risks linked to EMG in individuals with muscular dystrophy are generally low, yet they deserve attention due to the fragility of the muscles involved. First, patients may experience discomfort or pain during the procedure. This is because EMG requires inserting fine needles into the muscles. For individuals with weakened muscles, this discomfort can be more pronounced. Following the procedure, muscle soreness or bruising at the insertion sites is common. In those with muscular dystrophy, this soreness might last longer or feel more intense due to the already compromised muscle condition. There is also a rare risk of muscle injury from the needle insertion. Given that the muscles in muscular dystrophy patients are more vulnerable, extra caution is necessary to avoid any trauma during the EMG. Infection is another potential risk, albeit a very low one. Proper sterile techniques can significantly reduce the chances of infection at the needle sites. Minor bleeding or hematoma formation can occur as well, particularly in patients who have bleeding disorders or are taking blood-thinning medications. This risk is not unique to muscular dystrophy, but should still be considered. Lastly, while EMG does not cause the progression of muscular dystrophy, the process may temporarily exacerbate symptoms. The activation of muscles during the test could lead to increased fatigue or weakness in sensitive patients. Weighing the benefits of EMG against these risks is crucial. EMG can provide valuable insights that help differentiate muscular dystrophy from other neuromuscular disorders and guide treatment. However, it is vital that the procedure is performed by experienced clinicians who can use the least invasive techniques and monitor for any adverse effects. Patients with muscular dystrophy should engage in discussions with their neurologist or neuromuscular specialist before undergoing EMG. This ensures that the procedure is appropriate and that any risks are minimized. Personalized medical advice is key to balancing the diagnostic benefits with safety in this unique population.